Okay, we're going to move on to PAP titrations. Before we do that, let's just review the different options for treating sleep disordered breathing. We have the various PAP devices. Those are positive airway pressure devices. The different types are CPAP, where it's one continuous pressure, bilevel, where there's two pressures, an inspiratory pressure and an expiratory pressure. There's an auto PAP, where the machine adjusts to the patient on its own based on the patient's airflow. There's auto bilevel, and then there is also ASV, or adaptive servoventilation. Position retraining is an option, but that's only if a person has positional dependent sleep apnea, meaning when they lie flat on their back, they have apnea, but when they're lying on their side, they don't have any. Another option are different dental devices. These are becoming more popular, and dentists have become has a pretty good stance in the sleep environment now. Then there are also some surgical procedures that have been around for a long time. The success rate is a little questionable. And then lastly, there are nasal expiratory resistance devices, and those are like they look like a little band-aid that you put onto your nose every night. Those are the newest devices. Okay, for treating obstructive sleep apnea or any sleep disordered breathing, for the most part, treatment, the number one preferred treatment is PAP therapy. If a person is not able to tolerate their CPAP pressure, maybe because their pressure is really, really high, then they might be able to switch to what's called bilevel. And again, typically they move to this when their levels are high and the patient feels they're not able to exhale against the pressure, or they might just say it's just too much. Auto-PAP is another option for some people. It can be used and titrated at home with moderate to severe sleep apnea in those patients who have no other chronic health conditions or comorbidities. Auto-PAPs are ideal also for patients with positional sleep apnea because they can adjust to how severe their breathing is in different positions. Okay, but this activity is all about the titration process. Polysomnography in a sleep disorder center with manual titration by the sleep technologist. And we're going to look at the rules for doing this. Patients with moderate to severe OSA without any comorbidities might be able to use the AutoPAP at home for their titration, but really titrating in a sleep lab is the ideal way to go about it. Okay, so as we get started in talking about the titration process, I have three questions for you. What is the indication for CPAP? What is the goal of CPAP? And what is the benefit of CPAP? And I'm going to have you find those answers for yourself on the next slide, and then you can answer those questions.